Rib-on compared to other reinforcements. How is rib-on different than using a metal wire or mesh? Fiber reinforcements are far more effective at preventing fracture failures than metal wires or meshes. Fibers are used to reinforce industrial resins to make tennis rackets, boat hulls, and airplane body components, such as the Boeing 787 and the Airbus A350. Metal meshes and metal wires are not used for these industrial applications, as they are not effective reinforcements. When using metal wire or meshes, the dentist relies on a large bulk of composite resin to provide strength. Even then, the mode of failure of a bulky metal wire or metal mesh reinforced dental prosthesis is still fracture failure. A rib-on prosthesis is very thin and comfortable for the patient and much more fracture tough, resulting in much greater clinical longevity. Furthermore, rib-on is much easier to use than trying to bend a metal mesh or wire. Rib-on compared to other fiber reinforcements. Manageability. The most obvious difference between rib-on and other fiber reinforcements is its manageability and ease of use. Rib-on has virtually no memory and does not unravel when cut and adapted to the teeth. These videos demonstrate rib-on's superior manageability in comparison to other dental fiber reinforcements. Other materials either unravel when adapted or have too much memory, which makes them difficult to use and do not allow for close adaptation of the fibers against the teeth. Thick bond lines compromise clinical longevity by decreasing the shear strength of the composite resin layer between the fibers and the teeth. Having virtually no memory allows for close placement of the rib-on fibers against the teeth. Close placement not only results in thinner and more comfortable prostheses for the patients, but also results in thin bond lines between the fibers and the surfaces of the teeth. Just like a porcelain veneer or orthodontic bracket, close placement of the fibers against the teeth maximizes clinical results. Please see the video on the rib-on website that describes the mechanisms in which fiber reinforcements work and compares rib-on to other materials. Strength and fracture toughness. Dentists sometimes ask, how strong is a particular dental material, without realizing that there are many different qualities that define strength. To understand strength, you have to know what particular quality of strength relates to the expected mode of failure. We designed rib-on to be strong in the strength quality that material scientists value the most in a fiber reinforcement. This is the quality of fracture toughness. Fracture toughness is the quality of a material to resist the rapid propagation of cracks. Marketers of glass fiber reinforcement sometimes try to use flexural strength and flexural modulus, which are measurements of stiffness, to try to suggest clinical performance. However, any structural engineer will tell you that it is easier to design a structure for stiffness using non-stiff materials than it is to design a structure for fracture toughness using non-fracture tough materials. In other words, structural mode of failure tends to not be due to a lack of stiffness, but rather is due to a lack of fracture toughness. Why is rib-on the most fracture tough dental fiber reinforcement? The same fibers used to make rib-on are used to make bulletproof vests. Glass fibers are not used for the very simple reason that they are brittle and not fracture tough. This video demonstrates that by simply bending a glass fiber reinforcement back and forth, that the glass fibers can break. The glass fibers are not fracture tough. As these videos show, this is not the case with rib-on. Rib-on's patented lock-stitch Lena weave reinforces in multiple directions. Because of the mechanical interlocking of one thread to the next, any crack propagation in the resin is stopped. Unidirectional fiber orientations or loosely braided materials lack these mechanical connections of one thread to the next and therefore do not prevent cracks from propagating parallel to the direction of the fibers. Rib-on has an ideal bond strength of the fibers to resin. Marketers of glass fiber reinforcements suggest that high bond strengths of glass fibers to dental resins is a positive feature for their materials. These marketers take advantage of the fact that people in the dental industry generally equate high bond strengths to mean better clinical results. Although high bond strengths are desirable for bonding resin to teeth, counterintuitively, this is not true for fiber reinforcements. Physics and reality beat marketing hype every time. We refer to the work of recognized material scientists. As the famous material scientist J.E. Gordon explains, we do not want too high of a bond strength of the fibers to the resin. Although having high bond strengths might increase the flexural strength of the fiber reinforced structure, it has the very unfortunate side effect of creating brittleness. J. E. Gordon explains that we want the fibers to have a bond to the resin that is not too weak and not too strong. This allows cracks to deflect when they reach the fibers, which absorbs energy and prevents the rapid propagation of the crack. Ribond has an ideal mid-strength bond to the composite resins that maximizes its fracture toughness. A good example of this phenomenon is safety glass in windshields. A thin film of plastic is placed between the two panes of glass to act as a weak interface that redirects and blunts the energy of the crack from transferring from one sheet of glass to the other. Perhaps a more appropriate example of this phenomenon is tooth enamel. It is very common for tooth enamel to have cracks that have not propagated to a point in which the tooth has structurally failed. Each enamel prism is surrounded by a protein sheath. These protein sheaths create relatively weak bonded interfaces between the enamel prisms. These relatively weak interfaces blunt and redirect cracks, making the enamel fracture tough. If there was a strong bond of one enamel prism to the next, the tooth enamel would be brittle and our teeth would shatter with relative ease. Ribond, a fracture-tough material. The unique combination of Ribond's super tough bulletproof fibers, patented lock-stitch lina-weave, and bondability characteristics make Ribond the most fracture-tough fiber reinforcement available to the dental industry. This chart demonstrates the fracture toughness of Ribond versus a glass fiber reinforcement. Fracture toughness is measured in these charts by the gross area under the curves. Although a glass fiber reinforcement might have higher flexural strength, you can see how the gross area under the glass fiber curve is significantly less than the curve under the Ribond. For those dental professionals who wish to learn more about how fibers strengthen dental resins and prevent fracture failures, more in-depth explanations are available at our website, ribond.com. Go to Resources and then go to Fiber Comparisons. Some marketers of glass fibers claim that it is possible to polish glass fibers, but it is not possible to polish Ribond. This is partially true, but it is misleading. Because glass fibers are brittle, they can be cut with a burr at the same rate as the composite resin, leaving a smooth surface. Ribond is a fracture-tough material, and a burr will not cut it at the same rate as cutting the composite resin, resulting in fuzzy, exposed fibers. However, polishing really means cutting fibers. Just like you would not want to climb a mountain using a rope that has been cut, you would not want to reinforce resins with cut fibers. In other words, it is not a good idea to polish any type of fibers and expect them to effectively reinforce composite resins. Indefinite shelf life. Another unique feature of Ribond is that it has an indefinite shelf life. Most competitors have a shelf life of around 2 years. This is especially beneficial and cost-effective to dentists who might not use fiber reinforcements frequently in their office.